Hey everybody, Tim White, clinical specialist with our patient Tatum, who is doing a after video with us today, who had gone through the program, done your reassessment, you did great, but you wanted to come in and get checked up again because you wanted to make sure that your results were good and or not worsening. Not only did you not worsen, but you got better.
Yes, I did.
Way better than you were before, yes. Which was lower, better symmetry, better position, but you had some funny tightness feelings in the chest.
Yeah.
So we checked it out and we figured out most likely you're working out more or heavier, and we wanted to remind you to stretch. I think you're just getting sore, but it was worthwhile checking her out today. So you're treated, discharged, and you're now here a month and a half after we discharged you from before.
Yes.
And you're even better than you were before.
Yes, I'm so happy with my results. It was a really easy process. I did the consultation, and then I started the treatment like a few weeks later. We did the fast track, so I was here for 2 weeks. And then after that, I've just been maintenance rehab for 30 days. And then it's just been such an amazing result, and I'm so happy.
Because you were from New York, you came down here, so you basically did our fast track from New York.
Yes.
Right? Okay, so very good. So hey, let's remind everybody or tell everybody what the situation was. So you had your original breast augmentation. You had to have a revision because of the size of the implants.
Yes.
You then had your second surgery, and then after surgery is when the left breast started becoming tighter, firmer, harder, and raised up and sat high, right?
Yes.
So your surgeon, who we won't mention out of respect, who is arguably hands down one of the top most experienced surgeons, great surgeon, referred you to us and said, hey, let's do the Aspen to try and resolve Tatum's contracture, which we did successfully. So you went through the program. I don't know if you remember, subjectively, so we did the fast track on the last day. How much softer were you from 0 to 100%? You remember what you told us? I don't remember.
I was around like 85% softness.
So 85% softer. Yeah. And then we looked at the before and after. So how much down did it drop from 0 to 100% in that time during the fast track? Do you remember?
It was like 90%.
90% dropped.
Yeah.
Okay, great. So those are great numbers in improvement even in just a very short period of time.
Yeah.
Then we gave you a home program. You had stuff to do at home, massages, stretches, things you did. You got even better. You followed up with us. You were even better at the 30-day follow-up. Now here we are at the 60.5-day follow-up, and you're even better than you were before.
Yes.
All right,
Very
awesome.
happy.
So we took a look at Tatum's breast. Position is better. Softness is still good. We have a game plan now because we think that that tightness feeling and discomfort may be just some gym irritation and stretching. But this is a good point because we want to talk to other patients who have implants, whether you did Aspen or not. We want to talk to them about what a capsule is, how to prevent issues, but more importantly, how to maintain the breast implant and the capsule over time, right? So for you, stretching before exercise, all patients with breast implants should stretch their pecs before exercise. So we showed you the stretching in a door stretch, right? Real simple. Get your arms up in a door frame, lean in and stretch. Other things that we chatted with you about, we should share with everybody, is dental procedures, right? Dental procedures, because we went looking for why we think you encapsulated, and we think it was dental work right before the onset of your contracture that started this whole thing to begin with, right?
Correct.
Right, so dental procedures. Anybody with breast implants, actually anybody with hip replacements, heart valves, you know, any prosthetic or, you know, procedure that you have orthopedically in which there's a foreign object in your body, you run the risk of that prosthesis contracting or failing because dental work releases bacteria in your mouth. That bacteria triggers the immune system. The immune system saw your left breast implant and attacked it for no reason. And what it did is it caused this capsule shell, right, the balloon around the balloon, to thicken, harden, and squeeze and cause the implant to ride back up. So likely the dental procedure, maybe, maybe not. But, so dental work, stretch before the gym, pregnancy and breastfeeding can cause capsular contracture. Patients who have trauma, so patients of mine have been in a car accident, the seat belt or the airbag, boom, hits them, swollen, raised, black and blue. That can cause capsular contracture. Undiagnosed autoimmune disorders, thyroid issues, Hashimoto's, hyperthyroid, hypothyroid, right? My thyroid's too fast, my thyroid's too slow. Lupus, eczema, psoriasis, Lyme's disease, multiple sclerosis, all the autoimmune issues that you may have had or you don't even know you have could have been the triggering factor for why you got contraction. But I'm pretty sure yours was the dental work.
Yeah, I
agree.
agree.
Yeah. So you're young, you're healthy, you don't have any of those autoimmune disorders, so it's literally the only thing that we could find. And some people get contracture for no reason at all. You had a great surgeon who did a perfect job on a great day. Your surgeon is best of the best, multi-board certified, best of the best, and it can happen to anyone. So the bottom line is if it's high, hard, tight, uncomfortable, you lay on your tummy, right? Because before you laid on your tummy and you felt that ball like pushback, right?
Yeah, it felt like a brick. And
Right.
It felt like very uncomfortable. It felt hard. It was just kind of achy and disfigured and total.
Did you notice if somebody hugged you real tight?
Yeah, it was hard.
Hugs, you get that pushback feeling.
Yeah.
My patients who do yoga face down exercises, they get that feeling, right? They're face down on the floor. I know something is different. Patients know, right?
Yeah.
Even if you don't have a solid diagnosis, you knew something wasn't right.
I knew, you could see it. I could see it in pictures. It was disfigured. It was just not the implant that
Right.
I wanted.
You had this procedure for aesthetics, cosmetics, to feel good about yourself,
Yes.
to look a certain way.
Yep.
And then the irony of the condition is it does a 180, right?
Yes.
So we didn't get a knee replacement to be able to walk better, and now we walk better. We had a cosmetic procedure to look better, and now we look the opposite of the
Right.
way that we want to
Right.
look, right?
Right.
So the main goals that we did successfully with you were get the implant down, get the shape and the position looking better, get the softness better, resolve any discomfort, which really wasn't your issue. But then you got this new discomfort, which I'm still pretty sure is from the gym and working out, and that's the goal. So you did great.
Yeah.
Anybody watching this video, what advice could you give? You're watching this, you're looking at this, maybe you don't live near us, right? New York, California, Europe, South America, Zimbabwe.
I would say definitely start with the consultation. The consultation definitely helped me get a better understanding of what the therapy actually was. I always thought that surgery was the only option, and I didn't want to do the surgery again. I was, recovering for so long. This would have been my third surgery, and I was like, is there something else I can do? And then I came across, your treatment, and I was like, okay, let me just do the consultation. After the consultation, I was like, let's get started. And it was only 2 weeks that it took me to kind of start seeing results. And then after that, I did the rehab for 30 days, and then I really couldn't be happier that I didn't have to do any downtime, no surgery.
Right.
I could go in a bikini, I can go swimming. I didn't have to take any time off of work. So
If you'd had surgery, it would have been 2 weeks just recovering.
exactly.
Right?
It
So
would have been
in
way
2
longer.
weeks, you were almost fully improved and done with the majority of the progress that you made versus surgery. You were fortunate you had a very proactive surgeon. Your surgeon recommended this. If you're watching this and your surgeon tells you, I've never heard of it, I don't know anything about the Aspen treatment, I've heard it doesn't work, I heard it has no research, none of those are true. We've been doing this for a long time, 14 years, researched, proven in the plastic surgery industry, symposiums, lectures, top doctors from all over the world, top doctors, key opinion leaders, researchers, top doctors, own the system, use the system, have done research on the system, lecture about the system, and I want to politely remind everybody, your surgeon gets paid to do surgery, and in their defense, if your only tool is a hammer, everything looks like a nail to you, right? So if you can only do surgery, your surgeon is only going to tell you this. They may not validate doing a non-surgical treatment like Aspen. But the important part is we are all licensed medical professionals. You didn't have any weird people walking off the street in like a, like a maintenance outfit, or like the janitor came in to render.
So pleasant, so kind. I created a relationship with one of my therapists. It was so great.
Good,
Yeah.
good. licensed medical professionals, researched, proven results. You're going to be seen by a clinical expert. And Tatum made a good point. We'll do virtual with you, right? So we'll get on a Zoom call. We'll do a virtual with you. We'll look at shape, position. We'll squish. We'll push. We'll give you a diagnosis. And even if we can't help you, we can give you an option of what a plan B is, because in some cases you can't do this treatment. You have to have a surgery. But we'll guide you in that aspect in respect of if you do the surgery X, Y, and Z. And by the way, we've got a follow-up plan. And the follow-up would have been, had you not been a candidate, let's just say you were too encapsulated or the implant was ruptured, or some patients have really, really old implants with capsules, like 15, 20-year-old capsules. We have a prevention treatment because we discussed this with you. If you would have, even with your amazing surgeon, and I know your surgeon had this conversation with you, I could do surgery, but there's a very high likelihood you're going to re-encapsulate.
Yeah.
So why would you do that? Even if your surgeon gave you the surgery for free, would you really go in for the surgery knowing that odds worse than flipping a quarter, it can come back, right? So that being said, we have a plan B. You're the patient. We have to do surgery, so what we would have done is you would have had the surgery and then you would have come to Aspen to do the prevention treatment, which is 2 weeks after surgery, right? So surgery, then us 2 weeks afterwards, we combine medications with our treatment, and we follow a very specific protocol by which we pre-loosen, pre-stretch, pre-keep the pocket open, biologically address the trigger for the immune system, so then it prevents you from having even gotten to where you were before. So we can either treat an existing capsule, or if you're watching this and you're dead set on a surgery, or you have to have a surgery, call us now in advance. Comment below. Listen, if you have questions, how do I do the prevention? I'm going for surgery, Tim. What can I do? Comment below. Send us a DM. Tell us what's going on. We can coordinate your care after surgery, because what we don't want you to do is have a surgery and then call us 2 months later.
Yeah.
It's too late. I've already got a capsule. We can still treat you, not the same level of success. So Tatum, thank you so much.
Thanks so much.
You look great. Congrats on the results.
Thank you.
And Tim Wine, clinical specialist, signing off.